Thank you everyone so much for taking time out of your busy schedules to join the Congressional District Health Dashboard's virtual office hours for this month. My name is Dana Duong, and I am the research analyst here at the dashboard. Today, I am joined by Hannah Wade, who is our Senior Population Health Policy Analyst, and Avalon Aragon, who is our Program Coordinator, and they're going to help me monitor the chat and share with you all some helpful links. So in today's virtual office hours session, we will give a brief history of the dashboard, share some updates that we made in the last month, and we're going to dive a little bit into the data through a site walkthrough. So if you have any questions at any point, feel free to put them in the chat. I'll actually end today's session with a live Q&A, in which point you can come off of mute and we can answer your specific questions then. So getting right into our history. So rigorous nonpartisan data on health and the conditions that affect health were not widely available at the congressional district level. And so we created the dashboard and launched in January of 2023 to kind of address this challenge. As its first of its kind tool, our mission here is to provide that rigorous, accessible, and nonpartisan data on health and its drivers on a congressional district level. And so that's our goal here at the dashboard, is to provide users with an array of this data at the congressional district level that can be used to drive positive change at the district, state, and national level. We know data by itself can't change policy, but it can be an important facet in doing so. Data can illuminate challenges and assets in those communities that may have otherwise been hidden. It can be used to inform effective policy solutions, and data can be used to hold leaders accountable. And so the data on our site can provide some of that helpful information to support your data-driven decision making. So we built this tool actually for a wide audience. Think elected officials and their staff, like many of you are here today, advocates, journalists, researchers, really anybody who has an interest in data on a congressional district level. Our team is housed under NYU Grossman School of Medicine's Department of Population Health. And we built this dashboard actually off the success of our City Health Dashboard that was launched in 2018. Some of our partners include the Robert Wood Johnson Foundation, the Bipartisan Policy Center, and the Center on Budget and Policy Priorities. And so the big question is, what do we measure? So we have a total of 40 different metrics of health and its drivers, and they're divided into five kind of domains. So as you can see, we have the health outcomes domain, and under that, some metrics include breast cancer deaths, firearm suicides, frequent mental distress. Our other social and economic factors domain includes metrics like broadband connection, children in poverty, unemployment, youth not in work or school. And their other domains include health behaviors, physical environment, and clinical care. And so all of our metrics, you might see the orange asterisks, and that indicates we do have the demographic breakdowns available. So think the data that's parsed out by race, ethnicity, sex, or age. And then for the metrics that have the triangle, that indicates that we have the census tract level or the neighborhood level data. And so the Congressional District Health Dashboard data are drawn from federal sources and other data sets that adhere to rigorous standards of data collection and analysis. So these include the US Census Bureau, the Centers for Disease Control and Prevention, and the Environmental Protection Agency. All our measures aim to be actionable and reflect public health priorities. Our team of population health and policy experts, epidemiologists, and geospatial specialists regularly update the site with new years of data as they become available, new measures across the five overarching domains that you saw earlier. And so with that, the dashboard is so excited to announce that our first data release for the 2025 year, and continuing our mission to provide actionable, reliable, and nonpartisan congressional district health data to policymakers and users from diverse sectors seeking to improve health. And so this release includes updated district boundaries, 4 new metrics on health and its drivers of health, new years of data for our metrics, and an improved user experience. And so in keeping up with Congress, we updated our geography. So prior to the 2024 election, some of you may know that congressional district boundaries were adopted in five different states. And so those districts and the metrics in these states have been updated and recalculated on the dashboard to reflect the 119th Congress. And so these changes are also reflected in the district facts section on our page, and that includes some information on the population's demographics, the cities within those districts, and also the district's members' Congress. So we now include youth, not in workers school, independent living difficulty, food insecurity, and the designated primary care shortage area. The youth not worker school metric is the percentage of youth that are aged 16 through 19 who are neither working nor in school, otherwise known as disconnected youth. And this is a social and economic factor that's specific to adolescents. The independent living difficulty metric measures the percentage of adults who report difficulty doing errands because of a physical, mental, or emotional condition alone. And so this captures one of the 6 types of disabilities in the survey. Our food insecurity metric measures the percentage of adults who reported they did not have enough food and did not have enough money to get more in the past year. This is a multidimensional metric looking at economic and social determinants in contrast to a food access metric that really only looks at the geographic proximity. Our designated primary care shortage area metric is the percentage of population living in a designated primary care shortage area. So this is a geographic primary care health professional shortage area that's designated by the U.S. Department of Health Resources and Services Administration. And it's often used by federal and state governments to guide resource allocation. And for more detailed information and complete information on our metrics, including why we measure it, how we measure it, its underlying data source, and such, you can visit our metric backgrounds section on our site. And continuing our effort to provide timely measures, we've updated a total of 32 metrics with a new year of data. So this includes 10 new metrics from the American Community Survey, which now reflect data collected through 2023, and 10 metrics from the National Vital Statistics System, and 9 from the CDC's Places Project, which reflects data collected through 2022. We've also updated the Medicaid enrollment metric with another quarter of data, which is the second quarter of 2024. Our goal at the dashboard is to continually improve the user experience. While all of our data is totally free and accessible, so long as someone has access to Wi-Fi, we wanted our users to be able to download the dashboard data more efficiently. And so using the redesigned data download feature, you will be able to choose which metrics and geographies you want to download without the need for detailed computer code. Data will be available at the census tract or neighborhood level, congressional district, and state levels. And so that's all that I had for a brief history and also the new features that we've released in our data release last week. So this is the Congressional District Health Dashboard's homepage. And here you can enter in a congressional district or state that you know you want to look at. And if you don't know what district, you can enter in an address and it'll help you guide to the district that you're looking at. So let's say you wanted to look at North Carolina's 1st district. You can come here, select that, bringing you to the first part of our page, which is the health snapshots. And under this feature, we include metrics overview, where you can see all of the metrics, its estimates, and the comparison to the US average really at a glance. So that is one part of the health snapshots page. In the second part of this, we have district facts, and here you can see the population by age, race and ethnicity. You can also see the cities within the district. So if you hover over that, you can see that Rocky Mount will kind of appear there. And so we all have all the cities that are also included on our sister site, the City Health Dashboard. So this was a kind of a cross-linking between our 2 websites. And this might be helpful for users who might be interested in looking at cities within their congressional districts. And at the bottom here, we include some information on state and district representation. So I'm going to navigate back over to the metrics overview page. So here you can actually filter this out by the domain or the metric that you're interested in. So say you, let's just say you want to look at routine checkup. I'm just going to select on a couple from a variety of different domains here. You scroll back up and you can see that will filter out to only what you want to look at. So this might be helpful for you to kind of see only what you're looking at a glance. We also provide users with the ability to print this page. So if you click on this, you can print exactly what you've filtered out. So you can use that for your own work. In hopes of making the site really user navigable, we also kind of try to allow our users to move from different sections of our site. So say you're already here and you're looking at all these metrics in North Carolina's first district, and you wanted to know a little bit more about food insecurity in this district. You can click on it directly to bring you to the metric map section of our page. And here it really shows you all of the district, national, and state metric estimates in the map. On the left bar here, you can change the geography of interest, change the metric time period for which we have more than one available, and you can also change the scale bar here to the what you want to look at the average for. So in this case, you can see North Carolina state or the US average. And for select metrics, you'll see that it shows show census tracts. So if you select this option, you can see how the metric that you were looking at is parsed out on that neighborhood level. So across our sites, we include only the purples. So the lighter purples indicate better outcomes and darker purples indicate poor outcomes. So you can see here some kind of neighborhoods or areas within this district might have a higher burden of food insecurity compared to others. And if you wanted to be a little bit more specific, you can open up this census tract values tab, and you can enter in a specific census tract if you wanted to see that one only. Now bringing us to the next part of our site, which is metrics by demographics. I'm going to just keep looking at North Carolina's first. So let's say you wanted to see how some of the data is parsed out and broken down by different demographic groups. You can come to this part of the site and see all of the ones that are highlighted. It show you that we have demographic breakdowns available. So youth not worker school is also one of our new metrics. So I'll click on that, showing you how this metric breaks down by sex in North Carolina's first district. Again, on this left sidebar, you can change the metric, you can change the time period for what's available. And the next part of our site is compare metrics. So this is really helpful for those who want to look at metrics and how they look across different localities. So all different states, all different districts, and as the national average. So I'm just going to put in Arkansas, I guess. Again, you can change the metric quickly over here, change the time period, and you can add as many comparators as you like. So if you wanted to look at Arkansas kind of state, you can look at it on a district level. You can add anything that you want to look at. At the top here, you'll see the United States average as a point of comparison, and you'll see the scale bars in order of the comparators that you've added on this left bar. At the bottom here, we include cards, so you can see kind of where it falls on the map, and we include the sense-making statement down here for our users to grasp the data a little bit better. Also, before we talked a little bit about, our data, metrics, and like kind of the underlying data source, why we measure that. So all of that information can be found here in our metrics background. And the last thing on our site that I wanted to show everyone is the access the data page. So all of our data on our site is totally free and accessible to anyone as long as they have Wi-Fi. You just have to fill out a very quick survey, and then it'll bring you back to this page where you can use download our data dictionary, our technical document, and our geographic identifiers to support your data analysis. And down here, as I was talking about a little earlier, we had just updated this section so that you can download by metric or by state, and also the geographies that you wanted to look at specifically. So you can select any metric, filter that out, and once it loads, you can download the file for that. So that's all that I had for today's session. So we've gone through the site, explored some of our data, we went through a brief history and shared some more information from our most recent data release. And now I can open the floor to some questions. If you don't have any questions, please make sure you stay in touch with us by subscribing to our newsletter with the QR code on the screen or navigating to some of these helpful links that we'll be sharing in the chat momentarily. You can also be on the lookout for a follow-up email after this session. It'll have the recording of this, the slides, as well as a feedback survey so that we can continue to improve these sessions for you. But yeah, if there are no questions, I hope you have a great rest of your day. If you had questions, we will be staying here to answer some.